Hello everyone and welcome to today's session. And today we'll be discussing the theory related to the chapter Reproductive Health. So this is the part 3 of the lecture and we will discuss the NCERT section 3.3 in this session. Before starting this lecture, I just want to give you one information that the images, text and other materials used in the presentations are for education purposes only. We respect the intellectual property rights of the original creators and owners. If you are the owner and have any concerns or issues, please contact us at sathee@itk.ac.in and we shall remove the content immediately. Please note that parts of the content may have been generated using generative AI, which is experimental. So what are the objectives of today's session? So we'll talk about the medical termination of the pregnancy, which is also known as induced abortion. Within this topic, we'll talk about the legal framework in India and the permissible conditions, in which conditions the MTP is allowed. We'll talk about the key reasons for the MTP. Okay, are there any medical needs, or the MTP is being done because of an unwanted pregnancy? Okay, third one is the associated risk. So we'll talk about all of these under reasons for MTP. Then we'll talk about the social aspects related to the medical termination of the pregnancy. Within this, we'll talk about the illegal practices, gender-based abortion, and importance of counseling and healthcare. So we'll be talking about the medical termination of pregnancy. Then we'll summarize this entire lecture. We will discuss some NCERT-based question, and we'll be discussing some keynotes related to the topic medical termination of pregnancy. And in the end, there will be some interesting questions for you. Now let's begin with this topic, medical termination of pregnancy. So let's first understand what is MTP. So MTP stands for medical termination of pregnancy. It's a voluntary or intentional termination of pregnancy before full term. So what does this mean? So the pregnancy is for 9 months in human females. So termination of the pregnancy before the 9 months. This is known as MTP, and this is intentional. This is voluntary termination of the pregnancy. That's why it is also known as induced abortion. It is also known as induced abortion because it is done intentionally. It's a deliberate medical procedure to end the pregnancy. So medical intervention is required, and MTP is performed by medical professionals. And this is done to end the pregnancy. This is different from spontaneous abortions, also known as miscarriage. So this miscarriage, this is natural, this is spontaneous. This doesn't require any medical procedure. But MTP, this requires medical procedure. So this is not spontaneous, this is induced. So here you can see, this is an image showing you the medical termination of the pregnancy. This is showing you the induced abortion. The fetus is, you can say, removed, or it is killed. Okay, it is not allowed to develop, and the child is aborted. Now performed through surgery or medication. So MTP can be performed by two methods. First is by surgery, and second is by medicines. So by giving medicines also, abortion can be done. It is not necessary that surgery is required. The abortion can be done through medicines also. Usually the MTP is done within first 12 weeks of the pregnancy, because in the first 12 weeks of pregnancy, the fetus size is small and the risks are less. Why the risks are less? Again, because the fetus size is small, there will be less bleeding, and simple procedures are required to carry out the MTP. So the legal status of MTP varies by country. In some countries, the MTP is legal. In some countries, the MTP is allowed in some cases. Now, 45 to 50 million MTPs are performed annually worldwide. So you can see the number here, 45 to 50 million MTPs are performed. Now, 20% of all pregnancies end in induced abortion. So, out of all pregnancies, 20% of the pregnancies, they are aborted. So there can be many reasons for the abortion. We'll talk about those reasons also. Now, World Health Organization emphasizes the need for safe and legal abortion services. So to carry out this MTP, to carry out these abortions, medical professionals should be involved here. So it should be safe. These MTPs should be safe. If they are if these MTPs, if these abortions are done by unprofessionals, then it can be quite dangerous for the mother as well as for the child also. Now, post-abortion care should also be taken. Okay, so a lot of care is also required after the abortion also. Clear? The care of the mother should be taken. If the mother has undergone surgery, then obviously the care of the mother should be taken because there will be a lot of blood loss also. Okay, the post-abortion care is very important. Then family planning education should be given. So WHO emphasizes on the need for family planning also. So couples should be made aware of the family planning. So this will help, first of all, to reduce the population size. It will also help, you can say, reduce the maternal as well as the infant mortality rate. Okay. Then it will enhance the mother health also, mothers as well as the child health as well. So awareness should be spread regarding the family planning. Now, WHO also emphasizes on the need for the access to the contraception. The contraceptive methods or devices, they should be made available. And awareness should be spread regarding these contraceptive methods, also known as birth control methods. So by using contraceptives, these unwanted pregnancies can be prevented. And population can also be controlled. So this contraceptive can be used for family planning also. Now, MTP legalization remains controversial due to ethical, religious, and social concerns. Now, let's understand these concerns, ethical, religious, and social concerns. The first is the emotional aspect. So there are emotional, ethical, religious, and social aspects. What comes under the emotional aspects? So the mother is very much attached to her child. So abortion can affect the woman's mental health or mental well-being. So this comes under the emotional aspect. Now, during the pregnancy, the mother undergoes a lot of emotional stress and pain. So the mother is very much attached to the child. And there are a lot of changes going on in the mother. There are a lot of physiological changes, hormonal changes during the pregnancy. There is a lot of stress and pain during the pregnancy, even during the birth also. So these points come under the emotional aspects. And second one is the ethical concern. So within this ethical concern comes debates about the right to live. All right. So each and every person has a right to live, and humans, these humans, they don't have any right to kill anyone. So this comes under the ethical concerns. Now, religious views. What do you mean by these religious views? Now, religious beliefs about the value of life. So life is very important and life should be preserved, and no one has a right to kill anyone or abort anyone. Now, one more point comes under the religious views. Now, what different cultures believe and value? Okay. So different cultures, they have different beliefs, they have different thinkings. Okay. They value, you can say, the things according to their culture. Social issues. Now, under this comes the woman's freedom to make choices about their body. So it depends on the mother, okay, whether to carry the child or abort the child. Okay, because mother is bearing all the pain, all the stress. Okay. The woman has all the freedom to make the choices about their body and about the child. Then how it affects the population in society. So how this MTP affects the population and the society. So sometimes illegal abortions are being carried out. So if the couples, they find out it is a female child, so through prenatal sex determination, they can know the gender of their child. So if they come to know that it's a female child, then they abort the child, this female child. So this is known as female feticide. The cases of female feticides are increasing. And if it's keep on increasing, then it can affect the sex ratio of the population. So this comes under the social issues. Now let's talk about the MTP Act, Medical Termination of Pregnancy Act. The MTP was legalized in India in 1971. Okay. Now strict conditions were set to prevent the misuse. So although MTP is legalized in India as well, and throughout the, you can say, world as well, but strict conditions are set to prevent the misuse of MTP. So MTP Act enables safe and legal abortion services. So what comes under the MTP Act? It enables the safe abortion services, means the abortion should be done under the supervision of medical professionals. So they should be trained people, professionals who can carry out the MTP. And this should be done legally, because a lot of these abortions are done illegally by unqualified quacks or unqualified people. Only qualified doctors can perform the abortions. Now, procedures allow only in the registered facilities. So this MTP should be allowed only in the registered facilities. Okay, this is also done to minimize the cases of illegal abortions. MTP Act protects mother health and legal rights. So it obviously protects the mother health as well as legal rights of the mother, because mother can make the choice whether to carry the child or whether to abort the child. And these MTPs can be quite risky also if they are done in the later stages of the pregnancies. So this act protects the mother's health as well. So if illegal MTPs are being carried out by unprofessional people, then obviously the mother's life can be at risk. Okay, because there can be a lot of bleeding as well during the MTP. Now, legal restrictions exist to prevent illegal female feticide in India. So there are a lot of laws has been made, a lot of rules has been made in India as well to prevent the illegal female feticides. So the cases of female feticides are increasing day by day. Now, female feticide continue despite regulations due to gender bias. So still there are a lot of rules and regulations, but the cases of female feticides they are still increasing due to gender bias. Means the couples, they want a male child instead of the female child. So if they find out that it is a female child, then they abort that child. MTP Act restrictions aim to stop sex-selective abortions. What do you mean by sex-selective abortions? Again, if they find out, the couples find out it is a female, they abort that female. Now, what are the reasons for MTP? So there can be many reasons under which MTP is allowed. Okay. First is the medical emergencies. So if there is a risk to mother's health or mother's life, then the MTP is allowed. Sometimes the mother's body is not able to support the child. Mother's body is very weak. Her body is not prepared to bear the child. So in that cases, MTP is allowed when there is a risk to mother's life or health. Then in case of unwanted pregnancies, MTPs are allowed. So due to sexual assault or due to sexual abuse or due to rape, okay, in these cases, MTPs are also allowed. And due to contraceptive failure also, the MTPs are allowed. So this all come under the unwanted pregnancies. Then fetal abnormalities. When there are serious birth defect detected in the fetus, then also MTPs are allowed. Okay, so there are certain tests through which the genetic disorders can be determined in the fetus. So if there are very serious genetic defects on the congenital defects detected in the fetus, then also MTP is allowed, because they don't want the child to suffer all of his life or her life. In this case also, abortions are allowed. The next one is socio-economic factors. So there are a lot of financial constraints, and the couples, they are unable to support the child. So in this case is also MTP is allowed. The couples, they won't be able to support the child. So again, they don't want the child to suffer. So in this case is also abortion is allowed. Now let's talk about the medical termination across the trimester. Okay, so the pregnancy, it's for 9 months. Okay, and it can be divided into trimesters. So each trimester is for 12 weeks. Now first trimester MTPs means up to 12 weeks. So one trimester is for 12 weeks. Let's talk about the first trimester MTPs. So these are relatively safe. Okay. Then fetus is smaller. So why first trimester MTPs are safe? Because the fetus is smaller in size. Then simple procedures are used. The abortions can also be done using just medicines. Okay. Now let's talk about the second trimester MTPs, means after 12 weeks. So these are riskier. Why they are riskier? Because the fetus size is large now, and complex procedures are used here to abort the child. So that's why second trimester MTPs are riskier. Now there can be high risk of complications. So there can be a lot of bleeding, there can be infection, and there can be injury to the mother. Okay, so that's why the second trimester MTP, they are quite riskier. Now let's talk about the risk and issues related to unsafe abortions. Okay. Now first one is the illegal MTPs by unqualified practitioners. So illegal MTPs are being carried out by unqualified practitioners, by unqualified quacks, by unqualified people. Now done by untrained people. Okay, unqualified practitioners means these MTPs, they are done by untrained people, and this can be very dangerous. Okay, these are very unsafe and potentially they can be fatal as well. They are done in unhygienic conditions, so there are chances of infections. Okay, because these MTPs, these illegal MTPs, they are carried out in unhygienic conditions. There can be risk of complications and infections because of unhygienic conditions. Now, second one is health-related risk. Now, these illegal MTP, they're dangerous for both mother and the fetus because they're done in unhygienic conditions. They're done by untrained people. And this can lead to maternal death also, means it can lead to death of the mother as well because of these infections as well. And there can be excessive bleeding as well. Now, this results in psychological trauma also. Now, again, the third one is misuse of amniocentesis. So what is amniocentesis? The amniocentesis is a procedure through which prenatal sex determination can be done. And amniocentesis can also be used to determine the genetic disorders in the fetus. So this amniocentesis is being misused to determine the gender of the child. So what is done in amniocentesis? The amniotic fluid is analyzed, and this amniotic fluid consists of the fetal cells. So by analyzing the fetal cells, you can tell the gender of the fetus, whether it's male or female. This examines fetal cells from the amniotic fluid for gender determination. So amniotic fluid is taken out through the needle and it is poured in a test tube. And this amniotic fluid contains the fetal cells. Now these leads to illegal female feticide. So if the couples, they come to know it's a female child, then they abort their child. This is known as female feticide. Now this violates the law against gender-based MTP. So the MTP Act, under MTP Act, it is not allowed. You can say the sex-selective abortion is not allowed. So this violates the law against gender-based MTP. So here you can see this is amniocentesis. Through the needle, amniotic fluid is taken out, and it is taken out in the test tube. This amniotic fluid consists of the fetal cells, and they are analyzed, okay, to determine the gender of the fetus. You can see this is the baby growing in the womb. Okay, and amniotic fluid is taken from here. So needle is inserted through tummy to take out the amniotic. Let's talk about the sexual health and safety measures. Now, under this comes the provide effective counseling about avoiding unprotected intercourse. So awareness should be spread or counseling should be given to the couples so that they avoid the unprotected intercourse. Okay, so they should always use contraceptive devices, birth control devices. Okay, if they don't want these unwanted pregnancies. Now we should educate the people about the risk of illegal abortions. So these illegal abortion can be these can be quite risky, especially for the females, for the mother. So there are dangers of maternal death as well, because these are carried out by unqualified people or unqualified practitioner. Now there should be increased access to the healthcare facilities. So our healthcare system should be good, infrastructure should be good. These contraceptives should be made available. Okay. So our healthcare facilities should be good. The professional people should be employed to carry out these MTPs. Then offer education of safe sex practices. So again, education should be given to the, you can say, couples and to the children in the adolescence phase. Okay. On the topic safe sex practices. Okay. So again, here, the focus is to use the contraceptive methods. Provide information about the contraception. So awareness should be spread regarding the various contraceptive methods. Okay. So information should be given regarding the condoms, the IUDs, the oral pills. So there are different methods of contraception. So the professionals, okay, the medical professionals should give information, or they should guide the couples to go for which kind of contraceptive methods, which kind of contraceptive method will be effective for them. Now, ensure access to professional medical care. Professional medical care means professional, you can say, medical professional people should be employed to carry out these MTPs also. And these professional people, they can guide also. They can guide these couples about various contraceptive methods also. Then emphasize understanding of abortion-related risk. The information should be given to the couples, to the females bearing the child, that abortion they are relatively safe within the first trimester, and abortion can be quite risky in the later stages of the pregnancy. So they should be made aware about the abortion-related risk. Then improve maternal health services. Emphasis should be given also on to improving the maternal means mother health services. Now let's summarize this entire lecture. Let's talk about the global statistics. Annual worldwide MTPs. So 45 to 50 million MTPs are carried out annually. And these represents 1/5 of the conceived pregnancies. Means the 20% of all the pregnancies, they are aborted. 20% of them are aborted of the total pregnancies. Now, what is the legal status? Okay, it is quite controversial because it includes the emotional aspect, ethical aspect, religious aspect as well. Okay. Now, MTP was legalized in India in 1971, but these MTPs are only allowed under certain conditions. So there are a lot of restrictions which prevent the illegal female feticide, which prevent the illegal MTPs also, you can say. Now, what are the reasons for medical termination of pregnancy? The first is the unwanted pregnancies. The MTPs are allowed in the case of unwanted pregnancies, which can be due to contraceptive failure or due to sexual abuse or rape cases. And MTPs are also allowed if there is a risk to mother as well as to the fetus. Now, next one is the safety and concerns. Now, these MTP, they are safer in the first trimester, means up to 12 weeks. Why they were safer within the first trimester? Because the fetus is smaller in size and this abortion can be done using simple procedures. Then the abortion done in the second trimester, they are riskier and illegal MTPs are being performed. Okay. And amniocentesis is also being misused to determine the sex or determine the gender of the child. So amniocentesis has been banned now. Now, what are the solutions? First of all, protected intercourse counseling. Okay, so counseling or awareness should be given, the guidance should be given to the couples about safe sexual practices, about the protected intercourse. Then information should be given about the risk related to illegal abortions. There should be better healthcare system, and we have to stop this sex selective abortion as well. Now let's discuss this question. What are the main reasons for seeking medical termination of pregnancy? Now let's have a look at the answer for this question. So first is to terminate unwanted pregnancies from unprotected intercourse. The next one is due to failure of the contraceptive. So usually the contraceptives are quite efficient in preventing the pregnancies, but due to failure of contraceptive can lead to unwanted pregnancies. So due to failure of contraceptives, okay, the female can conceive, the female can get pregnant. So in this case, also MTPs are allowed. In case of sexual abuse or in case of rape, also MTPs are allowed, because this also comes under unwanted pregnancies. Now, when pregnancy poses risk to mother's life, then also MTPs are allowed. So sometimes mother's body is not prepared to bear the child. Mother's body is very weak. So in this case is also pregnancy, this abortion is allowed. Now, sometimes pregnancy can also pose risk to the fetus as well, because mother is quite weak. Okay, it is not able to support the fetus. In this case, also MTPs are allowed. Okay, and also when the pregnancy is dangerous for mother and fetus, in this case also obviously the MTPs are allowed. Next question: what are the concerning trends related to MTPs in India? A majority of MTPs are performed illegally by unqualified practitioners. MTPs are being performed in unsafe conditions, so they are performed in unhygienic conditions as well. So these can cause infections. Okay, and these infections can lead to maternal death as well. Now, there is a misuse of amniocentesis to determine the gender of the fetus. So if the couples, they come to know it's a female child, they abort the child. Illegal female feticide is done through the medical termination of pregnancy. Now, second trimester abortions being conducted despite higher risk. So second trimester abortions are riskier as compared to the first trimester abortions, because in second trimester, the fetus is of large size and complex procedure used for the abortions. So still second trimester abortions are being carried out despite higher risk to the mother, and there is a lack of proper healthcare facilities and counseling as well. Now let's discuss some of the major these keynotes here. First is the medical termination of pregnancy. What does this mean? This means voluntary termination or induced abortion before the full term. Now 45 to 50 million MTPs are performed annually worldwide. Legal status varies from country to country. MTP was legalized in India in 1971. Now, what are the key reasons of MTP? Unwanted pregnancy, contraceptive failure, rape cases, and medical necessity. Okay, what do you mean by medical necessity? Sometimes the mother's body is not ready, so there is a danger to the life of the mother. The mother's life is in danger. Okay, or if the fetus life is in danger, then also MTPs are allowed. Now, timing and safety. So abortions done during the first trimester or within the first trimester, they are safest. Abortion done after the second trimester, these are riskier. Professional care is very important during the MTP. What are the major concerns related to MTP? Illegal abortions are being done by unprofessional people, okay, by unqualified people or unqualified practitioners. Now, sex determination misuse is being happening. Like amniocentesis, using amniocentesis, the gender of the fetus was being determined. Okay, so this comes under sex determination misuse. The cases of female feticides are now being increasing. So this is also a major concern. Clear? So this can, you can say, affect the population as well, because the sex ratio will be, there will be imbalance in the sex ratio due to this female feticide. Then unsafe methods are being used for the MTP. MTPs are done by unqualified practitioners in unhygienic conditions. So this can cause infection as well. And this infection can lead to death of the mother. And how can you prevent? Okay. First one is that by counseling of the couples, by counseling of the people. Okay. So there should be, you can say, information should be given to them regarding the birth control methods. Okay. Now, next one is the health education. So by providing the, you can say, the people in the adolescent stage, or providing information to the couples regarding health education, this can also prevent these MTP. Now, healthcare access. So there should be healthcare access to all the people. Next one is legal enforcement. And there is a gender protection. The males are being protected. The females are being killed. So these are some interesting questions for you. First of all, given that 1/5 of all pregnancies globally end in medical termination, but social and educational changes could help reduce unwanted pregnancies while respecting women's rights. So you have to answer this question by yourself. Okay. So these questions will enhance your critical thinking abilities. Next one is, how can societies balance religious and cultural beliefs with women's healthcare needs and right when it comes to MTP legislation? Okay. The next one is, what measures could be most effective in preventing illegal MTPs and protecting women from unsafe procedures while addressing the root causes of why women seek illegal options? Okay, so these are some interesting questions for you. Okay, please think about it. So this is the end of the theory now. Now we'll discuss some DPP related to this topic. So let's discuss this question. Medical termination of pregnancy in India was legalized in which year? The medical termination of pregnancy is also known as induced abortion. So this was legalized in India in which year? What are the options here? 1951, 1971, 1981, and 1991. What is the correct answer here? Okay, the correct answer here is option number B, 1971. So MTP was legalized in India in 1971, although some regulations were set to prevent the misuse of MTP. Up to which week of pregnancy is MTP considered relatively safe? Okay, so these MTPs, these abortions, they are safe up to a certain, you can say up to a certain stage, you can say, of the pregnancy. Okay. What are the options here? 6 weeks, 12 weeks, 18 weeks, or 24 weeks? What is the correct answer here? Let's have a look at the answer here. Answer will be 12 weeks. So MTP, they are considered relatively safe if they are done within the first trimester, means if they are done within the 12 weeks. Now, why they are considered safe? Because the fetus size is small and the MTPs can be done using simple procedures. Now, let's discuss this question. Which diagnostic method is misused to determine the sex of the fetus, leading to illegal MTPs? Okay, so there is one method by which prenatal sex determination can be done. And this procedure has been misused to abort the female child. So you have to name that procedure. Options are ultrasound, amniocentesis, chorionic villus sampling, and blood test. So what is the correct answer here? Correct answer here will be option number B, amniocentesis. So in amniocentesis, amniotic fluid is taken out, and this amniotic fluid consists of the fetal cells, and these fetal cells are analyzed to determine the sex of the child. Now, let's discuss this question. What are the major reasons for the high number of illegal MTPs in India? What are the options? A lack of medical facilities, limited access to safe and legal abortion services. Option number C, high cost of legal procedures. Option number D is religious beliefs. So what will be the correct answer here? Correct answer here, option number B, limited access to safe and legal abortion services. The next question, which of the following is not a reason for performing MTP? MTPs are allowed in certain cases only. Here you have to answer from these four options, which is not a reason for performing this MTP. So first option is rape cases, second risk to maternal health, third is desired family size, and fourth is contraceptive failure. What will be the correct answer here? Correct answer here will be option number C, desired family size. So MTPs are performed, okay, in these cases, okay. In what cases MTPs are being allowed? First of all, or when there are unwanted pregnancies due to rape cases or due to contraceptive failures, or if there is a risk to maternal health. In these cases, MTPs are allowed. Okay, but desired family size. Okay, in this case, the MTPs are not allowed. Okay, so we have discussed the DPP also. Let's submit the DPP. So all our answers are correct. Okay, so this is the end of this session. I hope this session was quite knowledgeable for you. We'll meet in the next session. Thank you very much for listening.